KUNC and the NPR network, this is In The NoCo. I'm Brad Turner, in today for Erin O'Toole. A new study suggests that researchers should take a closer look at cannabis as a treatment for cancer and its symptoms. And the team behind the study says the results suggest the federal government should remove restrictions on that research. An organization called Cancer Playbook, which is based in Evergreen, paid for the study. Cancer Playbook's head of research says it works to provide people battling cancer with information about what treatments have helped other cancer patients, and that often includes medical marijuana. The study reviewed more than 10,000 published papers on medical cannabis. That makes it the most comprehensive analysis ever conducted on the topic, according to a recent story in The Guardian. Ryan Castle is the director of research for Cancer Playbook, and he led the study. It found that cannabis showed clear promise in many aspects of cancer treatment, from reducing pain to shrinking tumors.
So I went into this thinking, well, hopefully, we'll find enough information to say maybe this will be 55-45, showing maybe 55% support for medical cannabis across the board, just because that would allow cancer doctors and patients one more tool in their toolkit. Rather than 55-45, it ended up being closer to 75-25 in support. So 3 times the amount of support for medical cannabis in cancer studies was found.
Ryan talked with Erin O'Toole about the results of his study and why it's hard to get reliable data on the effectiveness of medical marijuana, which is legal in Colorado and many other states, but still illegal at the federal level.
It has really been almost a type of a catch-22 situation where it is extremely difficult to do clinical trials on how effective medical cannabis is, because as a Schedule I drug, it is prohibited from most clinical trials because it is a priori defined as having no clinical efficacy. And that's been one of the reasons why Cancer Playbook has relied on patient-reported outcomes, because even if we can't get clinical studies from the specific biomarkers and other testing in a laboratory, we can get patient-reported outcomes where they let us know how have their symptoms improved, and so on.
Sure.
And to support that, that's where we decided to come up with this meta-analysis on peer-reviewed research.
How does this lack of consensus around medical marijuana affect the information that is available to oncologists and other doctors who ultimately decide what treatment cancer patients receive?
It can be, unfortunately, very influential and very debilitating to the options that are available to cancer patients, because oncologists, by nature, and rightfully so, are very cautious people. And if they don't have concrete information, if they don't have statistically backed information showing more often than not this helps, they're usually going to avoid recommending it.
Well, let's talk about what you found. You looked at some really fascinating lab studies that isolated cancer cells or tumors and exposed them to cannabis. What happened to the cancer cells in the lab?
The clinical studies that we have in the analysis looked at what happens when you expose cancer cells to different formulations of cannabis. And what we found was that the cancer cells, when exposed to the cannabis, were actually undergoing something called apoptosis, which is the targeted destruction of cancer cells, which ideally leaves the healthy cells around it intact. And usually that is the target of chemotherapy when done correctly, but unfortunately often has a lot of collateral damage to healthy cells. So one of the things that we were excited by is the opportunity and the potential for cannabis to act as a complement to chemotherapy and other existing traditional cancer treatments, to hopefully be able to bolster the efficacy of treating the cancer while reducing the potential side effects.
That's incredible. Ryan, I wonder if you could share a story that stood out to you about how cannabis was useful in treating pain from cancer treatment.
Yeah. Well, I think the biggest one that we found that has not just statistical strength, but also resounds with me personally, and I suspect with a lot of people, had to do with the reduction in not just pain, but opioid addiction. We found that there was a very strong relationship between the introduction of cannabis as a cancer treatment and not only the reduction of pain that was in many instances described as on par with opioid prescriptions, but actually there was a 70% support for cannabis as a means of reducing opioid addiction, which is not the standard line that many of us have heard in terms of cannabis.
Sure.
But if it's a possible way of improving pain treatment while people are undergoing one of the most painful experiences in modern medicine and reducing the risk of coming out of that treatment with a debilitating addiction, that's something that as a researcher, as a public health professional, and just personally, that was something that I was really struck by and really excited to find.
What kind of responses have you gotten since this was published?
We're frankly shocked at the responses. We've experienced a tremendous amount of attention. We have gotten tens of thousands of views of the research article within the first day or so, which for a paper that's a 30-page statistical analysis is not what we're used to seeing.
Not exactly bedtime reading.
Well, it is if you want to go to sleep. But honestly, we are blown away by how excited and interested people are. And I think that there has been a strong appetite that we need to do something to improve not just cancer outcomes, but the quality of life of people undergoing cancer treatment. And I think the idea that there might be a roadmap to finding better ways to do that, which is what our paper was aiming to do, has resonated with a lot of people.
Yeah.
And we've naturally gotten some pushback. To be clear, we are an educational and information research company. We're not selling cannabis directly to anybody. We're giving people information about different ways to try to improve their cancer outcomes.
Good to know.
But yeah, overall, the response has been overwhelmingly positive, and we're really optimistic that this will help researchers and patients make better decisions going forward.
What would you like to see? What do you hope happens in the field of research as a result of what your study found?
We're saying that this is something that scientists should be able to study, that physicians should be able to help their patients with, and all of that is very difficult, if not outright impossible, at the federal level. At a more grassroots level, we would love for this to bring to the attention of more general practitioners and patients the idea of it's time to start having a conversation about what are the different complementary treatments for cancer.
Ryan Castle, Director of Research for Cancer Playbook, spoke with Erin O'Toole. Ryan led a research analysis that looked at more than 10,000 studies on the effectiveness of medical cannabis. We'll put links to his research and an article about it from The Guardian in our show notes and at kunc.org. That's it today for In The NoCo. I'm Brad Turner. Thanks for listening.